Mine is a brief talk about AI and lung cancer. Before looking into the applications of AI or artificial intelligence, we'll look into the AI and its subtypes which are used for imaging purposes. So artificial intelligence was a term which was first coined in 1956. Perhaps it dates back even before that. That is, if you have all seen the movie Imitation Game by Alan Turing, perhaps he is considered to be actually the father of artificial intelligence. And what do we really mean by artificial intelligence? Basically, these are computational based techniques which can mimic a human behavior or human idea or human behavior to sort of have a pattern recognition approach towards images. Next was machine learning, which was discovered or coined in 1959, which is another subset of artificial intelligence. Machine learning incorporates two types of learning, that is supervised and unsupervised. By supervised, we mean we have a training data set which has a known starting point and a known endpoint, and then the machine is trained or given sort of this known endpoint, which is considered to be the ground truth, and then the machine learns as to what really the expected endpoint would be, and subsequently the machine learning or the computation goes on into the validation phase for a generating of these endpoints, where the endpoints of the rest of the validation data is not really known. Next is unsupervised learning. So here the endpoint is not really known, but what this technique utilizes is cluster-based techniques, wherein the machine sort of looks at certain similarities or similar parameters which can be encountered in the images in our use case scenario, and eventually it comes to a conclusion as to what the output can be based on machine learning technique. The next subset and most newest discovered technique in this artificial intelligence is deep learning, which involves neural networks. And what are neural networks? These are nothing but networks which are similar to the brain parenchyma, that is, which comprises of neurons and synapses. And each of these neurons in the neural network are known as nodes. So these sort of mimic the behavior of human brain to come to an inference, sort of rationalize the pictures or images which are presented. There are three types of neural networks which are present. These are the artificial neural networks, which mainly deal with number crunching and can be used in the banking or finance sector. Then there are convolutional neural networks, which mainly deal with images. Okay, so this is what would be used as far as medical imaging is concerned. And next is the recurrent neural network, which deals with the temporal set of data. That is, say for example, if one was to do a tumor tracking over a longitudinal period of time, perhaps one would have to use what is known as a recurrent neural network, an example being ResNet. So this is one such example of convolutional neural network, that is a UNet, wherein based on the convolutional neural network, one can get a very accurate segmentation from an image. We'll see a couple of examples now. So as alluded to earlier, the main umbrella category is artificial intelligence, its subset being machine learning, and further subset of this machine learning is the deep learning technology. So what are really the applications of conventional neural networks as far as imaging is concerned? This includes classification. What do I mean by classification? That is whether or not there is abnormality present or not. So if we use a classifier on a CNN, it will be able to tell you whether a given chest radiograph is abnormal or normal. Then comes detection, wherein the CNN-based artificial intelligence technology will be able to detect a given abnormality in a radiograph, whether it's an effusion, whether there's a calcification, consolidation, cavitation, nodule, cancer, effusion, pneumothorax, etc. And then eventually segmentation. So segmentation is nothing but mapping or assignment of pixels to a particular abnormality or area of interest. So as a human, it is really easy for us to draw an outline along this mass in the right lung, or as seen over here. But on using CNN-based techniques, it involves a very research-intensive processes for actually coming out with accurate segmentation or sort of deciphering this lesion as being separate from that of the normal parenchyma. Moving on to applications, the first amongst which is deep learning based automatic detection. So at times there can be subtle masses or abnormalities which can be difficult to be deciphered by the human eye. And that is where deep learning based automatic detection techniques, that is a classifier based technique, can be used for detecting such subtle abnormalities. As in, this was a retrospective study wherein this abnormality in the right perihilar location was missed by the human radar, but very well detected on the radiograph and was later confirmed to be a mass in the perihilar location in the left lung. Next comes the detection, and this is the AI-based software which is actually in action in the TMH Department of Radiology, which can give you the scores of various abnormality that it detects. That is, it will give you a score of certainty as to what that abnormality would be, whether it's an effusion, a very high certainty, in this case on the right side, or whether is it consolidation, or whether is it a combination of these two, or whether there is any extra pulmonary abnormality. Again, another case wherein at times even these CNN-based techniques can fail, wherein the technique has annotated this area as a nodule. But if you look carefully, that's actually a lead which is used for monitoring of ECG of the patient, which was spuriously detected as a nodule in the lung parenchyma. Next is tumor tracking, which can be again another method of tumor detection by using what is known as recurrent neural networks, which is applied to longitudinal data, that is applied to data at different points in time during the course of management of a patient. And this sort of unburdens a radiologist of manually measuring the tumor and assessing the response as alluded to. And its importance has already been emphasized in the previous talk by the earlier speaker as to why do we need to measure and give those measurements as far as whether there is progressive disease, whether there is partial response, or whether there is complete response. And segmentation, as alluded to before, is nothing but mapping of pixels to an abnormality. And this involves mapping out a lesion very accurately. Again, can also be used in tumor tracking, just like detection techniques, but with far more accuracy, can give us volumetric measurements, which can be used longitudinally and which can perhaps be a more robust measure or parameter of giving tumor measurement compared to a unidimensional measurement. Next is AI-based dose reduction technique, which is again another work in progress, wherein we can see that there is a low dose CT which has been acquired, and we can see that this image is very grainy, that is, it has poor signal to noise ratio. But by using CNN-based upsampling techniques or noise reduction algorithms, we can see that we have a CT image which has far more better delineation, has sharper margins, and lower noise in this image. Again, you can also appreciate that these streak artifacts emanating from the bone on the left side are significantly reduced using CNN-based dose reduction technique. As emphasized by Dr. Kunal in his talk, it is quite pertinent to have low dose, that is low kV, low MS CTs, especially in biopsy studies, because we know that these studies have certain degree of radiation exposures, which by means of stochastic effect can lead to accumulation of the dose and can have certain hazardous effects like second cancers or even hereditary changes and mutation. Next is another example from literature wherein the classifiers can be further improvised such that the abnormality in the lung tumor can even be attributed to a particular mutation. Say, for example, whether there is EGFR mutation in a given tumor, which again has implications as far as management of patient is concerned. And this has been shown to be quite a new promising technique as far as CNN or deep learning of the lung cancers is concerned. Moving on from imaging to pathology, again, artificial neural networks, or rather convolutional neural networks, have a big role as far as whole slide scans reading is concerned. This is especially true in the setting of frozen section or giving an intraoperative diagnosis, because at times it can be really difficult without the use of immunohistochemical techniques to come down to a diagnosis, accurate diagnosis on frozen section and intra-op settings. And this is where CNN-based technique can be utilized or can be leveraged to give a better diagnosis. Likewise, it also increases throughput of a pathologist by augmenting his or her abilities of giving the diagnosis in a shorter duration of time and also to a better accuracy. Then the new kid on the block as far as artificial intelligence is concerned is what is known as federated learning. This is nothing but something like shared learning. So what happens in federated learning is that a CNN model is developed or trained at one given institute, and it is this model which can be distributed to other institutes in the network, such that the model undergoes training on a newer data set at those newer institute areas. And again, this model is what is shared back to this central server, so that one comes to what is known as a consensus. So that whenever we have this newer model which now encounters, say, a newer pathology or pattern type, it can very well recognize that pattern even when that comes to an area which is not really endemic to that set of disease in a scenario. So that is the new kid on the block, which is federated learning, which also involves transfer learning. And that is a really brief and very oversimplified view of artificial intelligence. And I thank you all for your time and attention. And I'll be happy to have any queries. None. Thank you.
Thank you, sir, for simplifying this complex topic of AI.